I was very, very thankful to have options when I needed them, because if this had happened to me a few years before, I wouldn't have had these options.
Being diagnosed with an incurable cancer is a heavy burden for anybody. Today, we speak with Dr. Marcus Butler at the Princess Margaret Cancer Center and Shannon, who's been living with melanoma since 2005.
Melanoma on the skin usually starts as an area of pigmentation that's slightly changed or irregular, and if it's noticed and picked up early, can be removed. By monitoring yourself, noticing moles that appear out of nowhere, or a mole that changes shape or grows, or a spot on the skin that doesn't heal. A lot of these very low-risk melanomas can be treated by the dermatologist, and that's it. Nothing more needs to be done.
I was initially diagnosed with low-risk melanoma in 2005, and I got it removed from a dermatologist. So I thought it was just something that you cut out and not something that you could die with. And then 2 weeks later, I got my diagnosis.
These cells, if they continue to grow, will infiltrate into deeper into the skin, and they can also develop the capacity or the ability to spread to other parts of the body. And unfortunately, melanoma is a very challenging disease, because when it does spread, it can go almost anywhere in the body. Patients with stage 1 or stage 2 melanoma often can be treated surgically, and the vast majority of these cases are cured. Patients who develop stage 4 melanoma often have a history of an early stage melanoma.
In 2010, Shannon felt her pinky toe and foot going numb. It was suspected to be pregnancy-related. 3 weeks later, her husband found her collapsed in the shower.
When we got to the hospital, at that time, I was in and out of consciousness. I don't remember a lot of it, but from what I understand, the only option they gave him at the time, because I was 24 weeks pregnant, and they couldn't take an infant at 24 weeks pregnant if something happened to me, was that they could put me on life support, because basically they told him that I was dying.
Oh, wow. When you're diagnosed with any cancer, it's like your world is about to swirl. We actually started Save Your Skin because when I was diagnosed with my melanoma in 2003, as a family, we had nowhere to go. Then you're referred to oncologists, you're getting x-rays and CAT scans and more information than you can ever take in. And I think for us, that's why it's so important when patients are first diagnosed that they call a patient organization, because we can actually really help them navigate the system.
The treatment of melanoma has been revolutionized. When I was a student and would see a patient with stage 4 melanoma, there was very little that people could do for these patients. We had some treatments, chemotherapy could be used, but it was really reserved for patients who had tumors that were causing pain, and we could reduce the pain for a while for those patients, but it wouldn't really help with their long-term survival. Then in the early 2010s, we started seeing that an immunotherapy drug could be used to treat patients. Response rate was not very high. It was in the 10 to 15% range.
I just needed a plan for me and for Maddie.
Shannon delivered a healthy daughter, Maddie, then underwent whole brain radiation and was treated with immunotherapy. Her melanoma remained stable until 2014.
At the beginning of the year, I started losing weight. My hemoglobin was dropping rapidly, as was my iron, so I was getting blood transfusions. And I got to the point where I was in so much pain, I just went to the hospital.
Thankfully, Shannon's doctor and Save Your Skin advocated for Shannon to be treated with pembrolizumab, a breakthrough in immunotherapy. She completed treatment in 2019.
As far as tumors go, I am tumor-free. So right now I get scans every 3 months. I have an MRI rotating with PET scans. And when I was on the treatment too, I didn't get sick from it. It didn't change my lifestyle. It didn't make me, it was amazing to me.
And that this misconception is dying out, is that, cancer therapy is terrible. And that's not the case. There really has been a revolution in the ability of us to deliver effective new therapies and deal with side effects so that people can live full lives.
Although encouraged, Dr. Butler reminds us of the importance to keep going within research and clinical trials.
The sorts of things that are happening at cancer centers like Princess Margaret are that we're working on clinical trials with new drugs which are designed to help the patients who unfortunately do not derive the home run effects of the immunotherapy or targeted therapy, where they still need additional treatment to control the disease.
We're now seeing huge success in a lot of patients in the metastatic setting. We have now led the way for many other cancer indications that are now starting to get these similar innovative medicines. Now I'm able to say not only do we have faith and hope, we actually have survivorship. We're not near finished yet. And I won't be happy till 100% of our metastatic melanoma patients are surviving, but we're getting there.
Today, special moments are very simple. Spending time with my husband and my daughter. We go hiking a lot. We've started snowshoeing, which is really fun. It's just the simple things, playing board games, just sitting with her on the couch, just being together.
For patients diagnosed with metastatic melanoma seeking more information, please visit the website below, saveyourskin.ca.